I work in Boston at one of the Harvard hospitals. And during the first wave, it's interesting how the psychological impact of the first wave was different from the second wave, especially for the healthcare workers in the ICU. But I myself was working in the ICU. We were doing surge ICU. So, it was pretty much 24/7 of the COVID ICU at that time. This was around April. And I noticed that when I reflected on my own life and the people around me, if we did have a second to reflect, that it was having a huge impact. And I wanted to capture that and the aspects of that. So with the help of a team and with some psychologist input, I wanted to do a quick survey. I knew the response rate would be really low because people are so busy, but we managed to get about 200 responses, and people really wanted to talk. So it was a mixed methods study with using the generalized anxiety depression scale as well as open-ended leading questions. And if you don't mind, I'd just like to show the graphics of this study so that I don't forget pretty much. So pretty much we asked, and then I did a qualitative analysis. I have a background as a master's in ethics, so I did have some background in qualitative analysis. I did coding of the responses that we got. We found that from the leading questions that we asked, which were, what are the frequent topics with which you worry about? What scares you the most? What are the fears? How do you balance your call of duty versus fears? What frustrates you about your daily duties? What is your reaction? How do you handle it? What are some of the actions taken in the ICU? Because a lot of wellness tools were offered, like free yoga sessions, virtual Tai Chi, food, etc., all kinds of things that the hospital could offer. We didn't have the luxury. I don't know if you've been to Longwood Avenue in Boston. We didn't have open spaces. So we pretty much had a brick concrete jungle around us. And that was adding to the burnout. We wouldn't see sunlight for days. And especially with the PPE, sometimes the carbon dioxide levels were rising within us and getting migraine headaches for 24/7. So those were the things that we were dealing with. I had 2 children at home, and I was quarantining from them, not because I was infected, but I didn't know what was going on. Nobody knew. So I would live in a small corner of my basement and not see my kids, not be able to hug them. So I could imagine what people were feeling. Basically, the groups that came out where there were a lot of negative emotions. People talked about how they did their own coping strategies, but there were also positive reinforcements and the call of duty, the fact that we thought of ourselves as fearless because nobody questioned going into these ICUs in the first wave. Nobody, even though the fear was there, it was tangible. No one held back from helping patients at that time. It was almost as if people were just taking this on as their role that they needed to play. And it was very altruistic. And then we asked for recommendations. As some of you spoke, we asked for what they wanted. Interestingly, there was, of course, a high rate of burnout, a high rate of fear, more so in women and in nurses. And also that could be the confounder that the response rate was higher from women. However, we found that even residents, the women were more affected. And then we also found signs of depression, trouble falling asleep, some actual physical symptoms. And then we found that the worry was also statistically significantly higher among women compared to men, the nurses compared to non-nurses. And then when we asked qualitative things, we found that fear of infection and critical illness and death was very high. There was uncertainty about the future. This was around April to May last year. There was no end in sight at that time. Vaccines was just I think it was just an idea at that point. There were a lot of staffing shortages. People were not getting so sick at that time. Our second surge was much worse, but I think the psychological impact of the first surge was worse for us. There was extreme workload. There were concerns about delivering futile or non-beneficial care. There were a lot of ethical dilemmas. I myself am interested in ethical end-of-life dilemmas. And I actually wrote a paper on allowing family members in the ICU with full PPE, even though there were no vaccinations at that point, and that was published. We were very interested in allowing, especially patients who were dying, and we were moving to comfort measures, having family members there for 1 hour. which was a compromise and a lot of back and forth with the administration. They were worried about the staff getting infected from families, etc. But we made a special a corridor for families to enter and take the patient there and then have them spend time at the last hour of their lives. We found that very hugely impactful for both the staff as well as the family. I myself lost my mother to who was in England at that time, and I was in the US, and I couldn't go see her, and I saw the whole thing on FaceTime, and I wrote about it as well. But I can understand what families go through when they're not able to have that grief, and there's just no closure. We asked about personal and professional sacrifices, the impact that the person and the staff is having on themselves versus as well as their family members. And people were just freaked out, as they said, quote unquote. They just were fearful. When I spoke to the psychologists, some very interesting aspects came out that 75% of the staff rejected wellness resources being offered by the hospital. So they did not find that the yoga and all of that as useful as they found mindfulness, being receptive to feedback, small mid-managerial level feedback sessions every day. I found the boss giving us town halls every day very, very reassuring. And at that time, remember, we didn't know what was going on. We didn't know the numbers. We didn't know the trajectory. So he had a bigger picture and he could share that with us. And I found that very reassuring. Frequent touch base sessions with mid-level management, for example, nurse managers. And I think some of you have talked about that in different variations. Reassurance, daily pep talks, and closing the feedback loop with actionable items, finding out what people really wanted. Empathy and communication came out and compassion came out right on the top. If people would feel that there was someone they could speak to and, you know, someone who could just reassure them. And I know that in our daily lives, we prefer that too. And we do that for our patients, but just holding someone's hand and working together as a team member was so much more useful, and that reduced the burnout I felt. And then we did a follow-up study, which did show that it did have an impact. And so in the end, I just wanted to say that humanism is right on the top of trying to deal with stressful situations. It's like a war. And in those warlike situations, having a leader or having leadership that is compassionate and open to, has an open door is always much better than having distance and being out of touch.